Good morning. Welcome back to Atlanta and Company. I'm Christine Pilar. It's so great to be with you. Many have questions and concerns when it comes to their reproductive health. Luckily, right here in Georgia, there's a facility that specializes in helping bring new life into this world. Reproductive Biology Associates was established back in 1983 as Georgia's first IVF treatment center. Their list of physicians have a combined 170 years of experience in diagnosing and treating infertility. And we're thrilled because joining me now this morning is Dr. Robert Straub. Welcome, doctor. Thank you for being here.
Good morning. Thank you for having me.
It's always a pleasure getting such great information about your facility and how you help couples. And today, we actually want to focus on homosexual couples. We always talk about heterosexual couples, but let's talk about how you help the gay and lesbian community have the families and achieve the families that they want.
Well, I mean, we feel that this demographic is poorly represented in our practice. Obviously, it's a very big demographic of Atlanta. But we are seeing increased interest in these individuals starting a family or expanding a family. And that's where we come into play as far as helping them out with their situation.
And let's start with lesbian couples. How do they get started? Where do we start there?
What happens, they come in, and sometimes they have a plan, sometimes they don't. Many times they have no plan, meaning that they're not sure as to which woman is going to carry the pregnancy, so they're investigating all their options. So we start an evaluation on both females. Sometimes they already have a plan that a specific one is going to carry the pregnancy. So we just focus on that individual. But ultimately it boils down to a basic evaluation, a female evaluation, consisting of hormonal blood testing, anatomic testing, and then we start helping them arrange for obtaining sperm.
Okay, that was my next question. Where do they get the sperm?
Well, there's essentially two options. One option, which is most common, is using anonymous sperm donation. And I'll come back to that in a minute. But the other option is sometimes they bring in a known donor. So they have somebody, a family, a friend, or somebody that they're interested in using as a sperm donor. And that actually is more complicated in the sense that it costs more. There's legal implications involved, so there's a legal contract that's necessary when using a known donor. So most people end up using anonymous sperm donation.
And of course, I'm sure that when you're obtaining these sperm donors' information, they get thoroughly tested, screened, so that the women will know exactly, as best as they can, about the medical history and the history of this person and their family, correct?
Correct. Now, when using the sperm bank, all of that is already done. All the testing has been appropriately done before that person the sperm is made available. So that testing is done through the sperm bank, and it's just a matter of selecting a donor. So I don't want to belittle the process, but they go to the internet websites and they start clicking on some basic demographics and they narrow it down to the specific donor. And once they choose, then they simply have the sample sent to our facility.
Okay, and so once it is obtained, then how is it actually used?
Depending upon the female evaluation, sometimes we can get away with some low-tech processes. Sometimes it does require more aggressive treatment. So some of the low-tech, the simplest hands-off approach is what we call a natural cycle insemination, where a person simply ovulates, we bring the person in, and we do the insemination. And that's more appropriate for younger people who have healthy ovaries. But sometimes we define or we determine that there's some underlying fertility problem that requires more aggressive treatment. So we use clomiphene therapy, which is an oral medication to stimulate ovulation. Sometimes we require injectable medications, which are just stronger fertility drugs.
Sure.
And then ultimately, sometimes it does require in vitro, the most aggressive treatment.
And let's talk about, for male couples out there, talk me through the process. How does that go?
On paper, it sounds pretty simple. Two men come in, we have to arrange for having an egg donor, and we have to arrange for having a gestational carrier. But in reality, it's a little bit more complicated in the sense that we have to do all that and bring a lot of the different pieces of the puzzle together to make all this work. And because we're using two men and a third party, meaning the gestational carrier, to carry the pregnancy, the men do need to undergo very extensive FDA-mandated testing, blood testing in some cultures and so forth to rule out any sort of infectious disease process.
Sure.
And then as far as selecting the egg donor, it's similar in the sense that you go to the website and we have an egg bank in our facility where they can then click on the demographics of the egg donors and then select the egg donor. And as far as the gestational carrier, many times these couples bring in somebody that they already have in mind to carry the pregnancy. Sometimes they go to different websites or agencies where they can recruit a gestational carrier. The most difficult part of that, I think, is simply putting your trust in some individual to carry the pregnancy and do the right thing.
Exactly.
Now, once they select the donor and select the gestational carrier, then we can put it all together, and it comes together in a couple of months' time.
All right, well, let's talk about it. You briefly touched on legal concerns regarding this kind of care. Talk to me a little bit more about that.
With respect to male-male couples, it's more complicated in the sense that you really need to have a thorough legal contract to protect the two men, but also the gestational carrier, meaning that there's no financial legal obligations back and forth once that child is born, who is the designated parents of that child, what kind of compensation is going to be involved in the whole process. Other more specific things, sometimes you have to define how many embryos are going to be transferred, what's going to happen in the instance of multiple pregnancies, or if there's some sort of complication in the pregnancy. And that's much more complicated with respect to the men.
Sure.
With respect to the female, a female would go through, simply have a pregnancy, and then if the other female would like to adopt the child, all that's done after the fact, after the baby's born.
Okay, so lots to consider, lots to think about, and that's why you're here. Thank you so much. We appreciate your time and great information.